Antiphospholipid Antibody Syndrome. Sounds like a mouthful. Let's shorten it down to just APS. But what is it? Is it as complicated to talk about as it is to pronounce? Not really. How about we start with the basics? Say the definition. Before we jump into that, we need to discuss the immune system. Everyone knows what the immune system does. It fights off infections and bacteria from the body. One way this is done is by making antibodies. Antibodies are proteins in the blood and other body fluids that bind to foreign objects like bacteria and viruses. This helps the immune system target and destroy them. But sometimes things go wrong and the immune system doesn't function correctly. Along with making antibodies to target the bad things in the body, it can sometimes make antibodies against the organs and tissues needed to survive. These antibodies are called autoantibodies. When this happens, it is considered an autoimmune disease. APS is an autoimmune disease, primarily focused on the circulatory system, that is, the flow of blood through the body. People with APS commonly have difficulties with blood clots, heart attack, stroke, and pregnancy difficulties, including preeclampsia, premature delivery by up to 10 weeks, and even infertility. How does this happen to the immune system? Is it hereditary? The easy answer, we don't know. If there is a pattern that makes some more vulnerable than others, we haven't found it yet. What we do know is that up to 5% of the general population is believed to have APS. Anywhere from 10 to 25% of women with recurrent miscarriages has APS. Of all APS patients, 90% are women. How is APS diagnosed? Well, it starts with education. While APS is one of the more common autoimmune disorders out there, many doctors know little to nothing about it. Because of this, it can go misdiagnosed and untreated. If you have suffered more than one miscarriage or a blood clot anywhere in your body, ask your doctor to test you for APS. If you are diagnosed with APS, you should know it's not the end of the road. While there is no cure, there is treatment. The most common treatment is anticoagulant therapy, which is highly effective in preventing future clots that could lead to a potential heart attack or even stroke. If you are a woman with APS, the use of an anticoagulant therapy significantly increases the chances of a positive outcome. There are some who will test positive for APS and live their entire lives with no manifestations of the illness. APS treatment is lifelong. Treatment of blood clots caused by APS outweighs the small side effects of the treatment. Most of the time, people with APS will appear on the outside just as they did before they were diagnosed. Because of this, it may be difficult for family and friends to understand that you have a life-threatening illness and that you just can't do some of the things that you could before. They can't see what is going on with your body, and this can become quite frustrating on both ends. Founded in 2005, the APS Foundation of America Incorporated is the only United States nonprofit health agency dedicated to bringing national awareness to APS. We are a volunteer-run, community-based 501 nonprofit public charity organization dedicated to educating and supporting the public. We also focus on research and patient services. If you would like more information on the foundation or would like to help our cause, please visit us on the web at www.apsfa.org. The foundation also has a place on the internet where you communicate with others who have this disease. Not only can you find answers, but you also find support and caring. While most members have APS, a portion of the members are loved ones who are trying to learn to live with someone living with APS. You can find our support forum at www.apsforum.com. You are the only one who knows exactly how you feel. Others with the same disease are very understanding, and support groups of some kind can make your life much more full. Your immediate family and children should be told about your disease, how it affects you, what it means to them, as well as what you may have to expect of them and support. The good news is, many people with proper treatment live normal, full lives. Others may find their lives changed forever due to APS, but a positive attitude will mean that life can still be worthwhile and fulfilling as the correct treatment prevents further problem. Come join us at APSforum.com. Get in the know and get in the flow of life.